Well, there's not much doubt that this Omicron outbreak has Australia's health system on the brink of collapse. Aged care providers are calling for the army to be brought in, and hospital staff, they're breaking ranks to tell true stories from the front line. And just when it appeared that both New South Wales and Victoria may have reached their peaks, both states recorded a spike, especially New South Wales, in daily infections overnight. To take us through what this means and what a return to school plan should look like when it's released tomorrow, I'm joined now by Professor Catherine Bennett, the Chair of Epidemiology at Deakin University. Catherine, thank you very much for your time. What happened to the peak?
Well, we have to remember that Wednesday usually has some catch up from the weekend. So we have a bit of a lag in the results coming through from the PCR part of the testing. Those numbers really picked up today, the number of total tests after the weekend. And so we always see Wednesday numbers bump up a bit.
Right.
If you map them as I've been doing, you actually see a pulse, which is, a slight drop at weekends and then the rest of the week. But nonetheless, the numbers are still relatively stable when you look at those 7-day averages. So we're still hopeful that at the very least we've come off that very rapid exponential growth that we were seeing early on. That has now slowed, and it still looks like we could be, levelling out, and that would be great news. We're also seeing some levelling out in the hospitalisations. Hard to read total hospitals because that includes people who, just representing the high rate in the community, are going there for other reasons and are positive, but that's still adding to the load in the hospital. So it's a very different story to Delta. We've got a lot more people who are now infectious in the hospital, and they've got staff exposure and patient exposure to manage in that setting, as well as the people there for the COVID infections themselves. So it's really complicated. That will continue for some time. Even if the numbers level out, we still have a number of people every day, even if they're the same and not rising, it's still an enormous number of new cases each day that can still lead to either people being so unwell they're in hospital, or that they have to go for other reasons and still add to this infection control challenge.
Okay. Now, tomorrow afternoon, National Cabinet will release a back-to-school plan. It will at least apply to New South Wales and Victoria, maybe other states and territories too. What should it look like?
Well, while we're looking to manage the infection control, not just if we have an outbreak in a school, as we've tried to do before, we're now again in a different situation with higher community rates. So this will likely include what we've already heard some states announce, active testing, so screening, and asking teachers and students to test a couple of times a week, even if they don't have any known exposures or symptoms, to try and pick up any possible signals that you might have infections in the school earlier than you otherwise would. You're actively trying to find them and have that early warning. They'll obviously also be looking at the protocols they put in place if they have an exposure in school. So that will include test to stay, probably, where you'll actually activate your screening on a regular basis for those staff and students who are around a case, so they can be monitored and not in the classroom if they're testing positive. But importantly, it includes those other elements that they will continue to roll out across schools, but will include some of those safety measures. So how masks will be deployed, what they'll be asking of kids in this higher infection time, particularly in areas where there's local infection rates in the community. So Omicron is across the state. When you're looking at the state level, it's there in all LGAs, but clearly the risk is different in some areas to others. So there may also be some news about what trigger level they have to step up the, how many kids have to wear masks and in what settings in school. So we're just looking for that detail to help keep them safe, the preventative actions they're going to take, but also where testing fits in that, both for early warning screening, but also for managing outbreaks, when you do have those exposures, which is almost inevitable when you've got reasonable rates in the community, but certainly when you've got the high rates in some of our LGAs.
Of course. We're expecting the fourth of our vaccines to receive approval in, any day now. I hear anecdotally from people that this is the dose or this is the vaccine that they have been waiting for. Is it possible that Novavax could see and spike our vaccination rollout again?
Look, it'd be great. I know myself, I too have heard of people who are saying, when's it coming? And for whatever reason, they've decided that's the one they're really comfortable
Yeah.
with. And so it may actually close some of that last remaining gap we have, the 7% or so that are 12 or over that aren't yet vaccinated. So that would be great to see that pick up, and it's fantastic that we finally are at that point where this took a long time coming, and it's this relatively small company, and they were worried about their ability to supply the world, but it's one there's definitely interest in, and it'll be good to see. Actually, getting that approved and out will be just topping up what we've been able to do in the primary course of the vaccination program.
One last point, in a story that came out of Hong Kong, we heard that a COVID-19 outbreak had been traced back to a pet shop in Hong Kong. And apparently health authorities then told a large group of customers to euthanize the pets that they brought from the pet shop. That sounds like a little bit of an overreaction to me, but what's it about, and is it an overreaction?
That's right. I heard that too, and I think it was guinea pigs that were the pets in question that I'd heard about.
Yeah.
The one thing about Omicron as the variant, which we're probably talking about in Hong Kong as well, is that it tends to, if it does infect quickly, and so if you've got a family and they've had an exposure, then presumably the guinea pig and the family might have had the infection. I don't know what the concern might be that animal would remain infectious or would be mingling with other animals, because generally, you expect a hamster or a equivalent to be, in a cage in the one household, and
Yes.
presumably over its infection now. So anyway, it just reminds us that it can cross species. It can add to the complication if you end up with reservoirs in other species. And I think they're being overly cautious, but just trying not to establish another reservoir that they then have to try and manage on top of the human reservoir that we're dealing with at the moment.
Professor Catherine Bennett, thank you for your time.
Thanks, Chris.